Morning. My name is Dr. Charles Obonyo, Chief Research Officer at Cambridge, where I do work as a clinical epidemiologist, focusing on non-communicable diseases. So I have been at Cambridge for the last 30 years, beginning off with research in communicable diseases, malaria, TB, and HIV, and 3 years ago moved on to non-communicable diseases, where my research group is focusing on the role of food and physical activity in the causation of diabetes and cardiovascular diseases.
Merci, s'il vous plaît, si vous permettez, je voulais vous poser une question. Il semble que vous travaillez sur les maladies non transmissibles. Est-ce que vous pouvez me dire pourquoi vous avez une motivation pour ces maladies et quelle est la place que vous accordez aux maladies mentales dans votre programme de recherche? Voilà. Une autre préoccupation, c'est que c'est lié à mes propres programmes de recherche, c'est une curiosité pour moi. Je voulais savoir, est-ce que vous avez des expériences de prise en charge des personnes qui souffrent d'une addiction à la drogue? Une expérience que vous voudrez bien partager avec nous?
Yeah, there are several reasons why I developed an interest in non-communicable diseases. For like over 2 decades, I worked on communicable diseases, but then realized that the burden of non-communicable diseases was rising. We were burying at least somebody every weekend from a complication of a non-communicable disease. For a long time, non-communicable diseases have been thought of as diseases of the rich, of the developed countries, but that is not the case anymore. In Kenya and other developing countries, the burden of non-communicable diseases is rising. And the whole population, be they poor or rich, are at risk of developing non-communicable diseases. When we speak about non-communicable diseases, basically we are focusing on the top 4 or 5, which include cardiovascular diseases, diabetes, cancers, and chronic respiratory, obstructive respiratory diseases. So more like the top 4. And for these diseases, the risk factors have also been found to be common. They include unhealthy diet, inadequate physical activity, smoking, and risky use of alcohol. So, going back to the question about my interest in these diseases, first of all is that the burden is rising. And secondly, our health systems is not prepared to deal with these conditions. For a long time, our health systems are focused on communicable diseases and were well developed over the past few years with technical and financial support from the Global Fund. Systems were developed for TB, malaria, and HIV, but none for the big 4 non-communicable diseases. And yet, over half of the bed space in our adult wards is occupied by patients suffering from either cardiovascular diseases, diabetes, cancers, or chronic respiratory diseases, or their complications. And about 40% of deaths in hospital and in the community can also be attributed to these diseases. And so they have become something that we cannot ignore as a government and as a research institute, and even as a health care system, systems have to be put in place to prepare the workforce, the financing of health, the supplies, essential supplies for health, to be able to cater for patients who have developed or will develop these conditions. And then very soon, I think these conditions will become epidemic, with more than half of the population afflicted or affected in one way or another. Then we are bound to see more of the population. There was this second part of the question about the role of mental illness. Yes, mental illness is a non-communicable diseases. As Cambry, we are not focusing on this yet, but I believe very soon colleagues within the research community will adopt an interest and take the agenda for health, mental illness, further. It's something that our government and One Health Organization is recognizing as a non-communicable disease, and having non-communicable disease is a stressor, which is in itself a mental illness, both financially and just the stress of having a lifelong disease that has no cure. And so it's something we are not focusing on currently, but it's something on the agenda that I believe as Cambry and the government of Kenya, very soon we will be focusing on the same. Already, I think a month or two ago, as a country, we participated in the Mental Health Month, raising awareness of suicide and other mental health illnesses that afflict society, that we need to be aware of, that we need to prevent. And so there is increased awareness of mental illnesses, but research into mental illnesses is still at infancy. But we believe it will improve, with funding and with increased priority setting. Thank you. I have a question for you. Progressively, the health system is moving on towards improving the health system management. The WITS School of Governance and Management generates or trains and does research on management and governance. My question relates to, do you have any programs focusing on health systems management? Specifically, I am interested in issues of non-communicable diseases and epidemics management. For a long time, our health systems have focused on communicable diseases. What plans are in place to train the next generation of health care workers to focus on non-communicable diseases, specifically issues to do with lifelong treatment, prevention, and health promotion issues, but also the acute effects of epidemics like Ebola and other emerging health issues. So does the WITS School of Governance and Management have any programs or plans to train health workers to be better prepared to manage non-communicable diseases and epidemics in Africa. Thank you.